Access to care, access to diabetes education is this year's theme for World Diabetes Day. Diabetes is a disease that occurs when your blood glucose level, also called blood sugar level, is too high. In a press conference held on Monday by the Ministry of Health, Dr. Frank Anthony explained that in order for persons to determine if they are pre-diabetic, an indication of 100 to 125 milligrams per deciliter, or diabetic, which is an indication of 126 or higher, a blood test is needed. He further went on to explain the different types of diabetes while encouraging persons to get screened, particularly if there is a history of diabetes in their family, to ensure they do not have the conditions of the disease.
There are basically two broad types of diabetes. We consider them to be type 1 and type 2. Type 1, you would normally see that in young persons.
Anthony relayed that there are a number of interventions that can be done for persons who are found to be pre-diabetic in an effort to stop the progression of becoming diabetic.
Interventions would include getting people to embrace a more active lifestyle. So a lot of persons who might be pre-diabetic might be overweight. So one thing is to get them to lose weight.
According to the health minister, there are several risk factors associated with diabetes, some of which are obesity, unhealthy eating, pre-existing conditions such as high blood pressure and cardiovascular disease. Similarly, someone with diabetes stands a greater chance of contracting the disease. With regards to the prevalence of diabetes, the minister stated that his ministry has a program in place that provides insulin to young people with type 1 diabetes, since the disease prevents the body from making its own insulin, creating the need for external supply. Dr. Frank Anthony urged persons with diabetes to be proactive with regards to getting medical checkups before they experience any complications.
So some of the very common complications that you can find is that people start losing their the sensitivity on their feet.
The minister stressed the importance of persons diagnosed as having diabetes to receive treatment in an effort to control their blood sugar levels and prevent complications from occurring. I am Renata Burnette, reporting for the HGP Nightly News.